Hi everyone, this is Saman. I'm a registered nurse with a decade of experience in emergency department and ICU. I'm a health coach and I'm certified by American Board of Regenerative Medicine. Here at Joint Space, we have started a wellness community support in order to support each other and our audiences and our clients towards a journey of well-being. And it's composed of a team of experts, all our colleagues here, specialists in their specific fields and what they are doing. In the past few days, we have had other sessions, breath work, stress management, meditation. And today I'll be taking you through some certain interventions at home, bare hands, while you're waiting for medical team to arrive. And what can you basically do at home while waiting during the initial critical minutes? The topic for today is fractures and bleeding. We are always predisposed to any of this. It can be due to an accident, due to a fall, an explosion, by any reason. Fractures and bleeding might happen. So we are trying to learn some new skills, daily skills. Not necessarily, you don't necessarily need to be medical professional, but this is a lifelong practice, not necessarily due to the current situation, whereas the current situation initiates the need to get prepared and not to get scared. Always remember that practice makes the master. I'll start with fractures and then we'll move on towards bleeding, and if something is missing or if we cannot cover, it will be postponed to the next session, which will be the next Friday, the same time, 2 p.m. What basically fracture is? A fracture simply means when a bone breaks down. I'll use simple terms, daily life terms, so that we can easily learn and memorize and put it in practice. When a fracture happens, it can be a complete breakdown of the bone, or it can be a crack, or it can be a partial crack. And we are going to cover all these topics about different types of fractures and different areas of the body. The common areas for fractures are wrist and forearm, and this usually happens due to stretched arm. For instance, when you are trying to fix something over a ladder or over a chair and you fall down, you usually fall down like this. And this palm is the first area that hits the floor. Wrist and forearm are common areas for fractures. Then upper arm is less common. Just to let you know, we have lots of small bones in our palm. Then we have 2 bones in our forearm, joint, and 1 single big bone in our upper arm. Then another prevalent area is our ankles and lower legs. And again, this happens because we literally are getting our balance from these 2 parts, and if a fall happens, usually the most common areas for fractures are lower leg. And here again, for the feet, we have lots of small bones. We have lower leg, which is composed of 2 bones, and then upper leg, which is 1 big major. In case a fracture happens, distant extremities like hands and feet are prone to bleed, but not much. Usually it's minor bleeding. But the major areas of bleeding, either external or internal, will be upper arm and upper leg, due to major vessels that are crossing over these areas. And then we have pelvis and a spine and a skull. And again, skull fractures are more common compared to spinal. And then we have a spinal and pelvis fractures due to the type of fracture and how you fall down or you get damaged or by any reason. This was a simple introduction of our skeletal system. Even though we have 6 bones in our rib cage each side, and we will be covering these items. So, how do we initially diagnose or understand if a fracture is in place? Usually when a fracture happens, we have some common symptoms and signs of a fracture. One of them is bruising and swelling. Bruising and swelling happens due to damage to the underlying tissue, damage to the veins, damage to the tissue, damage to the nerves, and all underlying structures. Swelling and bruises. Another indication and symptom is that affected area is super painful if movement happens. So meaning that person might not be able to move the limb, or the pain will get extended if you move the limb. Another indication is deformity, which is quite common, meaning it looks weird when you face a limb. It looks weird, it looks deformed, like a zigzag, or the skin, just to make it common, if it looks wrong, it feels wrong, or it moves wrong, treat it as a fracture until it's proven otherwise. And even if you suspect there is a fracture, still treat it as a fracture until it's proven otherwise. Because when a fracture happens, underlying tissues are prone to lots of complications. Just imagine that broken area is made of glass, and you have to stop it from wobbling, because the more it moves, the more underlying damage might happen. This is how you can easily understand if there is a fracture. So, swelling and bruise, deformity, inability to use that limb, and pain due to movement. We have 2 common types of fractures. Either it's open fracture or it's closed fracture. What does it mean? A closed fracture means a fracture happened inside the body and the skin is intact. So you might see the deformity, bruising, but you won't be able to see the bone, or there won't be bleeding which flows out of the body. That is closed fracture. Open fracture is when the bone cracks and penetrates from the skin. It protrudes outside. So bone is visible and bleeding is there. The bleeding might differ depending on which part of the body is involved, which we'll be covering. So we have 2 types of fractures, open and closed. The indications for both of them is almost the same: deformity, inability to use, it looks wrong, and pain due to movement. Whereas if it is open fracture, all indications will be there, plus you can see the bone. And the approach to these 2 types are almost common, but we have some further actions and steps if there is open fracture. The common rules for any type of fractures are: never push the bone back. Either it's open fracture or if it is closed fracture. Never push the bone back. Just leave it as it is. 2, never give food or drinks, because they are already under stress and there might be necessity of surgery, and because of nervous system stimulation, if they eat or drink, they might vomit, and the situation will get worse. And why did I say not to move the broken bone inside or try to straighten it? Because you don't know what part of tissue and vessels or nerves are involved. And imagine if a nerve is stuck over there and you push the bone, you might cut the nerve. So that is the reason that we don't make it straighten. Or even a vessel, if a vessel is stuck over there and you push it back, you might cause bleeding, whereas there wasn't bleeding before. So do not straighten the limb. Do not push the bone back inside. Do not give food or drinks. And do not move the patient unless they are in imminent danger. What do I mean by that? As a rescuer, first you have to check your own safety, because let's assume you are the only one who can help somebody who is damaged or in danger. So first we will check our own safety and our surroundings, and then we will consider the patient to help and rescue. So first we will check our own safety. Second, we will check the surrounding. If the area, the situation is dangerous, we need to move the client, but with minimum movement of the limb. And while we check that situation is under control and there is no imminent danger, we do not move the patient. We treat it right at the spot, the way we found it. I repeat, the minimum movement for any type of fractures. Now I'll start with some small tricks and hacks. What to do in case it happens in the street, at home, anywhere. With whatever that is around you, you just need to be first calm and confident. Second, creative. Calm and confident because always remind yourself that you are the only one over there can take action. Second, you have to be creative because it depends on what is available, what is around you, and where is the location. Now I'll invite my colleague to join me so that we can demonstrate practically. Miguel, please. Yes, please. So I'll be starting from fingers. What happens if a finger gets fractured? This applies to open fractures and closed fractures. So if a fracture happens to fingers, the best action is to use adjacent finger for stabilizing. For example, if this finger has been damaged, let's say a fracture, we will use the adjacent finger to stabilize these two fingers together. And how are we going to stabilize? We can use some simple tricks that are available everywhere. One of them is these simple business cards that we all have at home. Just put a couple of them on top of each other to make it a bit rigid, and then easily put underneath and tape it. Taping can be any taping. What do I mean? It can be a shoelace, to use it for wrapping. It can be a piece of tape, any type of tape, glass tape or medical tape, whatever that can hold all the area together. Another trick that can be used, and it is super practical, this is the core part of toilet tissue, what is wrapped around it. You can simply take it out and use it in two different ways. If it is closed fracture and it's just deformity, just squeeze a little bit so it becomes like straight, and then you can put the fingers inside. Easy and simple. Then you can wrap it with a shoelace, with a tape to make it stable. If it is an open fracture, which you can see the bone or there is bleeding, you can just squeeze it and make it flat, finger size, and put underneath. Here, the key point for whatever that you do for fingers is that to use adjacent finger to support. It's called body support. So it can be 3 fingers even, if 2 fingers are damaged. It can be even 4 fingers. So when fingers are involved, we will try to stabilize the broken finger with the adjacent one, which is not broken. If all are broken, then no other options. We will just stabilize all together. If the hand is smaller, you can simply use those business cards or those ice cream sticks, the wooden one, or the spatula. and then you can wrap it. If there is open fracture, let's say you can see the bone, or if there is bleeding, do not panic. Bleeding from this part of the hand is minor, so there is no harm to your health. And if there is open fracture, what are we going to do? We have two options. Either, if water is available beside us, we will pour with clean water. We do not touch. We do not use home remedies like coffee, like toothpaste, like powder, nothing. Just under running water. We don't scrub, we do nothing. So we will keep it down. We will assume this is water. Water will be just running over. And then, while we want to make it still, we will try to put a clean cloth, hand towel, or piece of tissue. And this is just to prevent, first, bleeding, second, infection. Because open wounds are highly susceptible for infection. So sometimes it happens that the fracture gets fixed, but due to infectious bacteria, this stuff invading inside the body, then the client becomes chronically ill. So if there is such a bleeding, you can use napkin, you can use kitchen towel, you can use even a clean shirt, and try to cover it. And always remember, we do not push over the fractured area. We do not squeeze. And when we want to bandage, the open fracture can be any part of the fingers or palm. We do not squeeze on it. If you want to control the bleeding and the bleeding is too high, you will consider 2 to 3 inches upward, and then you will gently squeeze. So for instance, if the fracture happens in any of these areas, we will squeeze here to prevent bleeding. Usually, since the bleeding is minor, it stops in almost 5 minutes. But if the blood is running, we will hold the pressure. We will hold the pressure to control, and then we can do an assessment, which is applying to all type of fractures and bandaging. At the end, how can we understand if we have sufficient blood flow? But the key point, I repeat, is to make it stabilized, not to move, not to push on top of that open area or broken bone. Simply we cover. Even you can use sanitary pads for ladies. You can use napkin, tissue, anything that is clean and can cover the area. The second part that is prone to fractures is this area, palm and the wrist. So if this area is also affected, again, the key point is to make it stable. How can we consider a wrist to stable? We need to use whatever that we have at home and slightly creative. The same core part of the tissue, or a phone box, simply. So here, as you see, we are covering below and above the fractured area. Why? Because we have a joint here. For fractures to stabilize, we need to consider, for example, if this is the midline of the fracture, we have to stabilize above and below the fracture so it doesn't move. So you can use phone box, you can use even piece of toy to make it stable, but pay attention if you are using something with sharp edges to prevent the risk of cuts. You will just simply cover it with a piece of cloth or tissue, so then these sharp edges will not affect the skin. And then you'll put it like this. And how to fix it? Again, shoelace to cover the area, for instance. Just to fix it. This is something temporary until paramedics, ambulance arrives, or even you can use a shirt, a t-shirt, to make it stabilized. Just be careful not to squeeze too much, not to tighten too much, so that you don't lose the full blood flow downward. This applies to fractures, but this doesn't apply to bleeding, which we'll cover at the second subject. For instance, if there is blood flow, then we will tight to stop the blood flow. Okay, this is for me. And the next step would be forearm fracture. So we said here we have two bones. Even forearms are less prone to heavy bleeding. So the bleeding is not our main concern, but movement is the first priority in fractures. And how are we going to stabilize the forearm? The same way. We can use toys at home, under and on top, down, and then stabilize with shoelace. The same, it can be shirt or whatever that is straight and flexible. It can be these training wristbands even, just to keep it still. Another item that is super practical at home is a spatula. These cooking spatulas that are super handy and practical. You can simply check the measurement. And here, as you see, bent. So it will look like this to support the broken area. And then you will fix it with t-shirt, shoelace, or whatever that is accessible for you. Or else you can use a magazine, a book, something that is flexible. Here, as you see, it completely covers the elbow. And then you need to fix it with a shoelace or whatever that is handy. So for instance, okay, hold the book. That's it. So it will become like this. If the fracture is on the forearm, if you can leave the patient as with the same position, all the best. But if you need to move the patient, if the patient needs to leave the area, then you have to use arm sling. Arm sling means eventually we will have the hand like this hanging with a scarf, with t-shirt, or with whatever that is long enough to support the arm around the body. And then you will fix. So the arm will stay close to the body, not moving, and safe and secure. Okay. Then we will have forearm open fractures. For open fractures, as I said, the priority is to stabilize. The second, for instance, if we assume that this area we have open wound and the bone is outside, we are not going to touch the bone. We are not going to cover the bone directly. We are going to cover surrounding. So for instance, if the bone has protruded from this side, okay, we will use napkin, tissue, clean cloth to cover around the area that bone is outside. So we don't touch the bone and we don't put anything on top of the bone, unless at home you have those medical gauze, the ones that are sterile and clean. And then we will cover around the wound. If there is bleeding, we will have gentle pressure to control the bleeding. And then the steps are exactly the same. We will stabilize. So for instance, if the Open fracture is on top of the forearm, so we will stabilize one from under, and this part will be bandage. The bandage can be a regular bandage if you have at home. If you don't, you can use a shirt like this, but keep in mind to leave that bone alone. Do not touch, do not push it back, do not put anything on top of it. And usually when you wrap the area, bleeding automatically stops, because here we are not predisposed for heavy bleedings. The next part is upper arm. Here in the upper arm, we have a big bone and we have large vessels, so just to show to the camera, we have major veins that are crossing from front, and we have arteries that crossing from side and inside the body. So this area, the fractures are really important, and you have to be extra cautious, because if you move inaccurately or if you don't handle, you might cause internal bleeding or external bleeding. For the upper arm, the steps are exactly the same. You can use phone box, you can use a spatula, you can use magazine. The key idea is to make it stable and prevent further movement. What is different about upper arm when you wrap? The same applies to collarbone, the bone that we have here. You need to do body wrapping. What does it mean? When you stabilize this part, okay, let's give it a demo. Hold. Obviously, in such a case, you might need 3-4 shoelaces, not one, to make it steady and still. And then you will do the same arm sling. But what is the key difference here? When you did the sling, right, and it's hanging, you need to wrap the arm towards the body. What do I mean by that? If you have a long shirt or scarf or if a bandage, you will wrap the arm around the body. This way you make sure that shoulder is not moving, elbow is not moving, and the bone, the fractured area, is simple and steady over there until professional medicals arrive, and for sure they have their own splinters and medical objects to use for stabilization. But this is what can you do at home with a scarf, with shoelace, with spatula to stabilize the area. Another fracture that is quite common comes from scalp. The scalp fractures are due to either you hit your head to somewhere or something falls off on your head. And the fracture from the scalp is usually with heavy bleeding. With the scalp, we are limited with our intervention, with our actions, but what can we do is to support the area. For such a case, if the fracture is minor, we will just use a clean cloth or clean t-shirt or clean napkin, and we will support the area. we are not going to push. We will just support the area to prevent infection, to prevent bleeding. And if the client is unconscious, if the patient is, the damage is too much, then we will make them sit semi-folar, like semi-sitting, and then we will just support the neck. Always remember, if you get suspicious that neck and a spine involved, fracture that comes from the neck or the spine, do not move the patient at all. Then I will show you, when my colleague is lying down, I will show you what exactly to do. The only way would be to support the airway. Talking about airway support in different conditions will be a topic for another session, but talking about fractures which involve neck and spine, the only thing that you can do at home is to make them steady and support the neck and prevent further movement. And it needs professional intervention. Then we will have rib fracture. So we said we have 6 bones from each side. And this might happen if there is direct damage to the chest. Our rib cage is indirectly attached to our lungs. So it's a very tricky area, because one wrong movement or action might even affect your lungs and compromise your breathing. For ribs, your actions are limited, but the best thing you can do if you get suspicious is a pillow. You will give a pillow to them and hug the pillow and slightly lean forward. This slight leaning forward and hugging the pillow alleviates the pain. And in such a case, while breathing, you do not use the muscles that you have between your ribs. And you'll be mainly using your diaphragm and the muscles from back, and you'll be using backside of your lungs. And in such a case, we encourage the patient to breathe slowly. There is pain definitely for any type of fractures, for any interventions that you do, splinting, immobilizing, pressing, there is pain. And let the patient know that there would be pain, but you have to manage the situation. Pain is inevitable, but the action comes first. You will ask them to hug the pillow, slightly lean forward, and try to breathe slowly. Move to the side. So it looks like this. If you get suspicious at rib fracture, and rib fracture again might come with bruises, might come with difficulty breathing, which when you take deep breath and your chest expands, the pain is really severe, then encourage the patient for shallow breathing, slow breathing until help arrives. Okay. Can we have these ones here? Now I need you to lie down. So, talking about lower body fractures. If the person already has the shoe, you can use the shoe itself as a splinter. You don't necessarily need to remove the shoe. We might need to remove the shoe if we suspect at bleeding, which will be the topic for the other part, but you can use the shoe itself the way you found it as a splinter. You can use a shirt to make it stable and wrap it around the wrist. You can use a blanket. You will slightly move the leg and you will wrap it the same way that it looks like, and then you can fasten it. How can you fasten such a thing? You can use a belt. A belt that we all have at home will be going underneath. And then you can fix it. For open fracture of the wrist, again, we don't have significant bleeding from this side, so it's not much of concern. But if there is open fracture, we are not going to push the fracture or cover the fracture directly. We will just cover surrounding area. Then we have lower leg fracture. So we said we have two bones here. In order to support this area, again, we can use the same blanket. The idea is the same, to make it immobilized. And we can use the belt or something stretchy to make it fixed. Or we can use a cushion or pillow and support and prevent further movements and wrap it with the belt. And also the same applies to using a magazine. My magazine, please. Thank you. The same again applies with a magazine. You just need to be creative and think, how can you immobilize the affected area? If there is bleeding, we will leave the fractured area open. We will just cover the sides. And if there is bleeding, we will slightly and gently squeeze 2 to 3 inches above the fractured area and the open wound. Then we have thighs. Thigh is a big bone, and we have major veins and arteries over here, and it's quite susceptible for heavy bleeding, either externally or internally. So dealing with fractures coming from thigh, you have to be super careful. Do not move at all. Splint it the way you found it. How can you do that? Again, there are some small and simple techniques. You can use the blanket and put it underneath and wrap it. You can use a jacket, a hoodie, under. You can use the hoodie and zip it, and when you did the zipping, you can use the sleeves as additional wrapping, so it becomes still. So you can simply use a jacket to make it immobilized, and at the same time, one of the things that you can use, which is available almost at every home, is a mop, a stick, wooden stick, something that is long and can support and make it straight, so it will prevent further movement. The same stick can go with the jacket, can go with the blanket. Even if blanket and jacket are not available, you can still use this one and use a shoelace to wrap it and make it still. And again, I repeat, the key idea is to prevent movement and keep it straight still as you found it until medics and paramedics arrive. For bleeding, you have to be super careful. For any type of fractures, consider situation. If there are multiple people, delegate to someone to immediately call emergency services, and you take action. If you're alone, immediately call emergency services, put it on a speaker, and take action. If bleeding happens in the thigh, based on severity, you have to take some simple actions. If the bleeding is minor, it's just oozing, you can just gently apply some pressure. But if the blood is severe, meaning it's pooling, it's spurting out, it's like flushing out, that simply indicates major veins and vessels are involved over there. In such a case, we need a tight tourniquet. Tourniquet can be a piece of scarf to wrap it tightly, for instance. From the groin, because the major veins and arteries are moving from the groin downward, and you have to make it tight. This applies because we cannot push over the fractured area which is outside. In the management of regular bleeding, we can just directly push, but since we have fracture, open fracture is two emergencies at one. First, fracture, second, bleeding. So we are limited with our maneuvers, but we can tighten. And when you do that, do not release it until paramedics arrive. Not even 1 minute, not even a second. But it's super important to note it down. What time did you apply the tourniquet? That's super crucial for medical interventions and in case there is a need for blood infusions. So you will tighten it with a scarf, with a shirt, with whatever that, even a belt. But if you are using a belt, make sure that you have something under the belt not to damage underlying skin. So we want to keep that integrity. And final thing about fractures that I would like to mention is how to assess if your wrapping is too tight or no. The same applies to toes and fingers. For instance, if you have a wrapping on forearm or upper arm or legs, fingernail, you will squeeze for 5 seconds. When you squeeze for 5 seconds, it becomes pale and white because of lack of blood circulation. When you hold it for 5 seconds and you release it, within 3 seconds, it has to turn to pink. That means the blood flow is sufficient. If it takes longer than 3 to 5 seconds, meaning the wrapping is too tight and you need to loosen it. Okay? So we will do it together once. 1, 2, 3, 4, 5. So now my finger will be pale when I release it. Within 3 seconds, it has to turn to pink. 1, 2, 3. Usually it turns to pink in almost 2 seconds because we have sufficient blood flow. So this is the most effective key indication that even we use it in the hospital setting to understand if we have enough circulation or no for any type of wrapping. But if there is severe bleeding, this rule doesn't apply because the key part is to control the bleeding. If you loosen the tourniquet, then you are losing the blood. So it's fine to keep the tourniquet to control the bleeding until further help arrives. I don't know how much time do I have, or we are done. We have now only 5 minutes. I don't think we will be able to cover the blood, how to control a bleeding. Maybe we can cover it for the next session. Please write it down for me if you have any questions, any techniques that you want to know, or anything that might happen to your mind, what to do in certain areas. I can respond during the next session. And the next session, I'll be talking about bleeding, and if time allows, we will be talking about airways. The whole idea is, please don't panic. Usually when you face a fracture, deformity, and especially if it's open fracture, people panic. Panic is not going to help nobody. It's useless. Please try to hold your confidence. Try to practice at home. Practice makes the master. And be prepared for any area to take initiative actions, creative actions. For any type of fractures, we have some common rules. I want to repeat again. Do not move the client. Do not try to straighten the limb. Do not push the bone back inside. Do not give foods or drinks. And what we do, we will immobilize the way we found it. We will call emergency services. And we will try to wrap and control the bleeding. That's all we need to know with whatever that is provided in our surrounding area. And again, I would like to invite you to join our community wellness support. conducted by Joint Space, a team of professionals and experts. Everybody tries to share their expertise and skills in order to support our audiences, our patients, and we are always here for any type of questions. You can drop a message on WhatsApp, email, or direct phone call. You are very welcome. Please stay safe and take care. Anything else that we need to do? I think we're done for today.